Reye's syndrome. What is Reye's syndrome and what causes it? Reye's syndrome is a rare but serious condition that causes swelling in the liver and brain. It affects children and teenagers who are recovering from a viral infection such as the flu or chickenpox. The exact cause of Reye's syndrome is unknown. Factors that are thought to increase risks are using aspirin to treat a viral infection or having fatty acid oxidation disorder that is undiagnosed. It can lead to brain and liver damage or death if left untreated. Symptoms. Reye's syndrome usually starts showing up when a child is recovering from a viral illness, usually appearing 3 to 7 days after getting sick. The first symptoms may include sudden vomiting, lack of energy, strange behavior such as irritability, personality changes, and slurred speech. It also can contribute to sleepiness. Other symptoms may develop as liver and brain damage get worse. Confusion, fast, deep breathing, violent behavior, seizures, and comas. How is it diagnosed? If children have any of these symptoms and has any of the contributing factors, seek immediate medical help. If Reye's syndrome is not treated quickly, it can lead to death. Your doctor will run blood tests and urine tests, a liver biopsy, a head CT scan, and a spinal tap. Treatment for Reye's syndrome is done in the ICU. Since there is no effective treatment, the main goal when getting treated for Reye's syndrome is to stop damage to the brain and liver that might cause more damage. Recovery is based on the severity and progression of the disease. Most children recover with no problem if it is caught early and symptoms are mild. Potential impacts on the individual. Common impacts a person faces is brain damage and disabilities ranging from slight motor or learning disabilities to profound brain injuries. The severity is based on each individual case. Potential educational impact. Specific problem areas include problems with attention, problems with memory, difficulty with concentration, speech and language difficulties, problems with fine and gross motor skills, changes in the child's activity level, and difficulty with task completion. Any or all of these problems areas listed above could generate into learning or academic problems. Following Reye's, a pre-existing learning problem could become more severe. As a teacher, support is extremely important. For the individual with RS, schooling can become increasingly more difficult than before. It is important to be patient with the student and accommodate to the student's needs in order for them to succeed. For parents, offer resources that are available. Positivity is also important. Although brain damage is not reversible, it is true that much progress is possible. Keep a positive attitude to encourage the student. Resources and professional organizations. National Reye's Syndrome Foundation is an organization and charity whose mission is to raise awareness on Reye's syndrome. On their website, you can find more information on what RS is and specific information on the health risks of aspirin, along with an article over life after RS. U.S. Food and Drug Administration provides information regarding medications and other products that contain aspirin. Madison's Foundation connects parents to other parents that have children with rare diseases. RareShare is a website that allows people to communicate and build that community with others who are affected by a rare disorder.
Reye's syndrome. To help understand this disease, picture a normal, healthy child One day he or she contracts the flu or perhaps chicken pox, seems to be getting better. Then suddenly and very quickly, the condition worsens. Just days later, the child is dead. Joining us are John and Terry Freudenberger, founders of the National Rise Syndrome Foundation. And I know your involvement comes from your experience. You lost a child to Rise, as did the Dick Van Dyke family. The difference is yours was how old?
She was 5 years old.
5, and yours was, granddaughter was 13.
Yes.
Is that uncommon?
It is for older, but there's instances up to 20, aren't there,
Yes.
John?
That's right.
Yeah. What should we know about Rise?
Well, I think every parent should be aware of the symptoms of Rise syndrome, which usually occur after a child has had the flu or chicken pox. They begin continuous or relentless vomiting, and this is accompanied by a loss of pep and energy. They're very tired. They're uninterested in their environment. They become very drowsy, and this progresses on to a personality change. They might become aggressive. They might also strike out at those family members who are trying to help them, and this progresses on to a coma.
Medically, what do doctors say about what's going on inside the child? And what's happening to the immune system? What's happening to their bodies at this point?
Well, Rise attacks the liver and the brain, and what's happening to the child is that their brain is actually swelling inside their skull until they go into a coma, and then in 30% of the cases they go on to death.
So most parents really are not aware of how devastating this can be until it's almost too late, or until it's too late. And they treat it, what, as just the flu, I suppose, and offer which some people hold as the culprit, aspirin. But yet aspirin isn't, or is it? I mean, what role does aspirin play in Rise syndrome? I've heard a lot of...
Well, aspirin was first implicated back in 1974 by the FDA in a bulletin. And since that time, it's become more implicated. Every study that's been done has implicated Rise syndrome to the point now that you could almost, say for certain that Rise syndrome and aspirin go hand in hand. Aspirin is not necessarily does not necessarily cause Rise syndrome, because there have been cases documented where there was an aspirin involved. But certainly, most doctors now believe that aspirin is one of the causal factors.
Yeah. What was your situation with your granddaughter?
Well, Jessica had chicken pox, and she began the vomiting and became disoriented and violent, aggressive behavior. But the doctor never thought of, it's so rare. They don't think of Rise. They don't think to test for Rise. And her brain had started to swell, and she had gone blind. And they ran into the hospital, and they had to they bored a hole in the head and begin to drain it.
Yes.
And but within 3 days, she was gone. There was no saving her. By that time, it had a renal failure, her heart. Cardiac arrest is what finally killed her, but they say even if they'd stopped the Rise, the treatment itself caused so much damage to every organ in her body. It comes so fast.
Well, that's what
the main thing is
the time frame we're talking about here.
Yes.
What kind of time are we talking about?
I guess that's one of the tragic. It can be even quicker than that.
Yeah.
We've seen cases where from the onset to death, it's been a matter of 4 hours. So, so you have to be able to, the doctors and the parents have to be aware. They have to know what they're looking for. If you're going to be able to do anything for these children, the doctors have to be able to diagnose it and get them into the hospital and get them into some treatment protocol now. The Foundation's attitude right now is that we want to see children's aspirin taken off the market. We don't want children to have aspirin unless they're under the care of a doctor.
Well, there are warnings on a lot of the aspirin bottle labels now about Rise.
Yeah. Did your granddaughter take aspirin?
Yes.
She did. Well, it's so tragic. Do you have other children?
Yes, we do.
Yeah.
We have 3 children, a daughter and 2 sons.
Well,
We've kind of grown up with the Foundation.
Being with us, John Terry. I know you have a poem that Jessica wrote, don't you? Would you share that with us?
Yes, I would. It's not a happy poem, but she wrote poetry from the time she was 6. She was a magical, spiritual child, and some of the things she wrote were profoundly prophetic. So many of her poems, and I thought I just wanted to read this one called Nightmares. So, yeah, in the dark I lie, paralyzed. The world around me is forgotten, gone. The nightmare creeps up into my brain, stealing consciousness. It slithers over me like an evil snake. Forgotten are warm friends and family. There are but mere flashes in life. For when I am forsaken in my nightmares, I am but one creature departed from life, lying desperately trying to fight my nightmares, which is a prophetic of the... Yeah, she wrote quite a bit about life and death. Very strange.
Yeah, thank you, Dick, very much. And thank you, John Terry, for spending this time with us. If you'd like more information about Reye's syndrome, you can write to the National Reye's Syndrome Foundation, P.O. Box 829, Bryan, Ohio, 43506.